there he is. Yeah. Sitting in the back, taking it all in.
Salmon going the wrong way.
Good analogy. Welcome. Your first issue is the air monitoring network.
That's great. I think if it's okay, I'll read a very brief prepared statement on that.
Of course.
And okay. I'd like to say good morning. Still morning. I see to Chairman Bloom and the members of the committee. I'd like to thank you for having me here today. My name is Brian Leahy, Director of the Department of Pesticide Regulation. I'm here today with Lou Sapon, who's the branch chief of Fiscal Services. I'm going to give you a very brief overview of our department, and then we'll address the three issues. DPR is the most comprehensive pesticide regulatory program in the nation. The Department of Pesticide Regulation's mission is to protect human health and the environment by regulating pesticide sales and use and by fostering reduced risk pest management. Our basic work includes pesticide product evaluation and registration, environmental monitoring, residue testing of fresh produce, addressing pesticide risks to human health, and statewide licensing of commercial applicators, dealers, and advisors. DPR also provides oversight for local pesticide enforcement programs through the county agricultural commissioners and their combined staff of approximately 280 biologists. DPR's proposed 2016-17 budget is $97 million and 402 positions. This includes 11.5 new positions that are being requested for in the BCPs. These new positions are critical to helping DPR address ongoing and emerging issues, including the following. The first on today's agenda is our BCP to continue DPR's air monitoring network. The BCP requests 1.5 positions and $468,000 from the DPR fund to continue the air monitoring network. DPR created the air monitoring network as a limited-term project to monitor ambient air pesticide concentrations and to calculate the human health risk from exposure to multiple pesticides for long periods, both annual and lifetime. The air monitoring network is an important part of DPR's mandate for the continuous evaluation of registered pesticides. Issue number 2 is our BCP for 2 positions and $482,000 from the DPR fund to address the growing need for DPR to develop strategies to mitigate pesticide impact on workers and bystanders. DPR completes risk assessments of pesticides and, when warranted, comes up with restrictions and mitigations so pesticides can be used safely and not adversely affect human health. This BCP adds resources to the mitigation process. As DPR completes more risk assessments, we're averaging 5 a year, the need to mitigate increases. This BCP will help DPR mitigate faster and to come up with protections quicker. If the chemical is a toxic air contaminant, the law requires that we come up with these mitigations within 2 years. The third issue is our pollinator protection BCP for 2 positions and $335,000 from the DPR fund to address increased workloads from pollinator protection issues. One of the proposed new positions will go to our registration branch and will help review data studies. As part of the President's federal strategy to promote the health of honeybees and other pollinators, US EPA now requires much more data and studies to address and evaluate the potential for acute and chronic toxicity to pollinators. The new data requirements increase by at least 4 times the number of studies DPR must review for each registration. The second scientist will go to our enforcement branch for increased enforcement and education on how to better protect bees. This work includes educating growers, beekeepers, and regulators on pollinator protection issues to reduce the pesticide exposure to bees through timely communication and coordination among key stakeholders. This concludes my presentation or comments, and now if there are any questions.
Thank you. I don't have any. Any questions from the dais? Any additional comments from Department of Finance or LAO? Are there any public comments on any of these 3 items? No No one from the public is stepping forward, so thank you very much for the presentation. We will vote on this shortly. Call forward now Office of Environmental Health Hazard Assessment, OEHA. We have the acting director, Lauren Zeiss, here today. Welcome. As with the DPR items, we have a recommendation to approve as budgeted on your item. Welcome.
Thank you. Thank you, Chairman Bloom and members of the panel. With me, I have Alan Hirsch, who's OES Chief Deputy Director. So what we have in front of you is a decision support tool to support the State Water Resources Control Board in prioritizing water systems. The funding's for 2 years. It's to develop statewide metrics related to the adequacy of California's drinking water. And it will focus on issues of water quality, affordability, and accessibility, and represent systems in maps. And again, the work is to provide information to assist the Water Board in prioritizing drinking water system improvements.
Thank you.
Okay.
Any questions? Additional comments? Public comments? Thank you very much for your presentation. Department of Food and Agriculture is next up. Mr. Houston's back. Thanks. Welcome. Welcome back.
Thank you, Mr. Chair. Jim Houston, Department of Food and Ag. We have 2 items before you. The first has to do with the Asian citrusillid, which is the, I always get the acronym, but CPDCP, which is the Citrus Disease and Pest Control group. Anyway, the budget request is for an increase in authority of $1 million. Due to basically an increase in the amount of fines that we've had. So the ACP is, a very active bug. It can fly a long way, and so we, are continuing to attack it where we find it. So, and the numbers of fines that we are getting is increasing, so we need an increase in authority to spend basically the money. It's not an increase in general fund requests or anything, it's just authority to spend special fund money. It's a very virulent pest. It's done, I think, $1.7 billion damage to the Florida citrus industry, and now that we have the actual disease that it's a vector for in California, although it's not in commercial citrus, it's just really important that we are able to contain it where it's at and slow the spread of the disease. And then the second one that we have is, the California took a great step last year. This legislature and our governor showed a lot of leadership by passing SB 27. And SB 27 has a somewhat phased-in implementation, so the actual restrictions on use go into effect January 1, 2018. But in the meantime, we have responsibilities to do monitoring and stewardship and to start to lay the groundwork for the inspection and data collection that we're going to need to do. So the BCP requests $1.4 million in 8 positions for fiscal year, and I think 1.8 ongoing. We'll certainly be back next year to talk about the sort of implementation phase for the data restriction, but for right now, we just need to get going on the stewardship creation and the monitoring piece. So if you have any questions, I'm happy to answer them.
Does the citrus infestation have the potential to be the kind of infestation that just breaks out suddenly from where it is now, much in the way that infections can in the general population? Or do we feel that if it starts to spread, we're going to have enough lead time to ramp up addressing it?
Yes and no. I mean, so there's always the potential for some sort of, I guess, explosive event, from a probability perspective. But we certainly are confident that, the resources that we have to bear in the program, one of the really nice things about the program is the level of cooperation that we have with industry throughout the state. The committee, Mr. De Leon was the author of the bill that created the committee. Nothing's ever smooth when you get a whole bunch of folks together and trying to solve a crisis like this. So, there's lots of lively discussion, no doubt, but I think the level of interaction, is sufficient. And I think there would be enough lead time for us to, request additional resources. So I don't think that we have, necessarily any holes in the safety net right now that would, there's not like a pocket somewhere that we're not unaware of or something like that, which I guess could be the explosive type of event that you're looking for. There is always the possibility because the disease is dormant. A tree could have a disease and you might not know it until the symptoms manifest. And that's one of the reasons why we're so concerned about the spread of ACP I guess potentially there could be a backyard somewhere with a bunch of trees, but it's a really, really low probability. So we feel confident in what we've got.
Thank you. Mr. Patterson.
Were you, Citrus folks were in town
Yeah.
yesterday. Were you meeting with them yesterday?
Yeah, I had an orange and a lemon on my lapel. I gave them to my kids when I got home. But yeah.
Good. Had conversations with them. Obviously, I represent large swaths of citrus in the area. Some concern, and my understanding was this was raised in communication with those in the governor's administration that they met with yesterday. And that's some were taking some notes with respect to the. By the way, I've been in broadcasting a long time. Owned radio stations in Fresno for a long time. We are using the public service announcements that basically say, "Look in your backyard, report it, call it." I've been told by a number of our citrus folks that when people respond to that and call the phone number or the several phone numbers, rarely do people answer. Now, this is, there's no data, no survey, but a number of members made calls 3 o'clock in the afternoon, 3:30, not outside of regular business hours, and either were put on hold or phones weren't, or the people on the other end didn't even know what they were talking about. Now, I passed that along. I don't know how deep or wide that might have been, but the citrus folks said that the meetings with the governor's people noted it and were going to really take a look at it, and they were reasonably pleased with the interest of those. But I would just like to reiterate it to at least try to determine whether or not we're at. Yeah. Their concern was we're proposing phone numbers and response, and when people call, sometimes the people on the other end of the line aren't even sure what. I'm not even sure what long bong, but that was something that was mentioned to me by my citrus folks as they came through the area, and I just wanted to pass it along.
Yeah, I appreciate you bringing that to my attention. Honestly, it's the first that I'd heard of it, and we'll find out. That's absolutely unacceptable.
Came from the former president of the California Citrus Mutual, the former president.
I'll find out what's going on. Just so you know, I know it's one of my pet peeves, I guess. At the very basic level, you should answer the phone. People, when they're calling government, should get a response, and people should know what they're talking about.
Well, it should be a knowledgeable response. I think the bigger concern was he called. This was the former president of CCM. Yeah. Called several times, didn't get an answer. When he did get an answer, the other person on the other end of the line was not conversant in the issue.
Well, we'll find out what happened and make sure it doesn't.
And he expressed that yesterday to the folks that were
when you respond to Mr. Patterson, if you could make sure that my office is alerted as well.
Yeah.
Let us know what the situation is, and if there's corrective action needed, what the office is doing about it, please. Your second issue is also important, the use of antimicrobial drugs on livestock, and where we stand with trying to scale back that use.
Yeah, so we have 5.5 positions that are going into the animal health branch, and 4.5, sorry, that are going to the animal health branch, and 3.5 that are going to the feed program. Both of those, they're in separate divisions, but they are sort of integral links of the chain. So one is at the feed mills and regulating the feed authority, and the other interacts with livestock producers and the veterinarian community. And so we're really fortunate to have Dr. Jones as our state vet. She's a national leader in this issue. She's part of, I think she's the head of like some national group, an acronym which I would butcher, but she has really done yeoman's work in reaching out to stakeholders, both internal sister agencies, but also external. We will be shortly holding the first of many sort of work groups, which will be a very large stakeholder base. And these positions are designed to start the stewardship program. To develop a stewardship program requires a lot of development of data and information with academia and with livestock producers, and so these folks will help lay the groundwork for that, and then also understanding sort of what the scope of the monitoring program has got to entail, trying to take an inventory of places, and so these positions would really go a long way to getting that off the ground and running. And then, like I said, 2018 is when the actual restrictions and inspection kick in, and so there'll be an increased workload come then. And then I didn't know, did you want me to address the market?
We've got Michael Dimmock, who is here to present on that.
Okay.
Yeah, on market match.
Thanks. Chairman Bloom and members of the committee, thank you for inviting me to speak in support of $5 million for the new statewide nutrition incentive matching grant program created last year with the passage of AB 1321. This program is built on the evidence-based success of Market Match program, which is now operating in 240 markets across the state, where CalFresh benefits are doubled when spent on California's healthy fruits and vegetables. Nutrition incentives are good for families receiving CalFresh, they're good for California farmers, and they're good for the state healthcare budget as well as our economy. In 2015, 4.4 million Californians received CalFresh benefits, adding $7.5 billion to the economy. Approximately 42% of those folks, or 1.8 million, are vulnerable Californians who are food insecure, meaning they didn't have a consistent ability to buy food. These same people suffer disproportionate rates of diabetes. Diabetes treatment is already costing the state over $37 billion a year in health care expenses and lost productivity. It's also known that 9% of our adults are diagnosed with diabetes, 46% are pre-diabetic, and 33% of our young adults, 18 to 39, are already pre-diabetic, meaning the cost is going to go up dramatically. We know that Californians are concerned about this. Ongoing evaluation of the Market Match program shows that demand for nutrition incentives far outweighs supply. Sadly, only about 30% of the state's markets and virtually none of our retail stores offer incentives, despite their benefits. They spawn healthier food shopping habits, increase CalFresh enrollment, and create jobs in farming communities. 2 days ago, the USDA published a blog clarifying that nutrition incentives are an important part of a comprehensive approach to achieving significant decreases in childhood obesity. The USDA has also shown that every dollar in SNAP expenditures creates $1.79 in economic activity. And even more importantly, a recent study by the UC Davis Small Farm Program has shown that for every dollar of local produce sold through a farmer's market farm stand or CSA box, $1.83 in economic activity is created. So these nutrition incentives are important, and they've also shown that they increase between the purchase of fruits and vegetables at farmers markets by 130 to 700%. So, given the success in combating hunger and diabetes and so much demand, California must maximize its share of the federal dollars available through the Food Insecurity Nutrition Incentive Fund established in the 2014 Farm Bill. This USDA competitive program requires a match from each applicant. California has 10% of the nation's farmers markets and 11% of the SNAP recipients, but we have so far failed to get a fair share of the federal nutrition incentive funds because California's market match has been limited to philanthropic support. This is why our budget proposal asks for a modest one-time investment of $5 million. This will allow California to apply for at least that amount from USDA. But we have competition. Legislatures in Illinois, Missouri, and Massachusetts are creating state matching funds right now. New Mexico, with bipartisan leadership, has been providing nutrition incentive funds for 2 years already. We need general fund support in California to maximize our drawdown of the federal funds. So we urge the legislature to take advantage of AB 1321, which established a mechanism within CDFA to leverage state funds to maximize the federal match for California's Nutrition Incentive Matching Grant Program. Based on the data gathered by Market Match, we know that $5 million from the state and $5 million from USDA can boost the sale of California produce by $40 to $60 million, increasing healthy food access and support for our rural communities struggling through the drought. In closing, nutrition incentives have proven they are an economic engine and a health improvement and maintenance program that will prevent future suffering and budget-busting expense. Thank you.
Thank you very much. Thank you for the presentation. We're going to hear from the public in a moment on all of the DFA issues, but I just wanted to add a very brief comment echoing the sentiment that you've already expressed about not just the issue of hunger and food insecurity around the state, but particularly the crisis and epidemic of obesity, diabetes, and pre-diabetes, which we recently learned through a study out of UCLA is significantly worse than we thought it was. And pre-diabetes, for those who don't know, are folks who show the signs of being prone to diabetes and will become diabetic unless corrective action is taken. So it's programs like this that are severely underfunded in the state that need to be addressed. We know that California has the lowest funding of any state in the country right now when it comes to addressing diabetes and obesity. This is one small step that can help address that crisis, and I'm very happy to be able to support it here today. Let's see if there's any members of the public who'd like to be heard on these issues. Thank you all for being patient. I'll bet you've been here for a while.
Hello, my name is Ben Feldman. I'm the Director of Food and Farming Programs at the Ecology Center. We're the current operator of the Market Match program, having taken leadership of the program over from Roots of Change in 2013. We see on a day-to-day basis the importance of this program for both California's small farmers as well as market shoppers. The program is a meaningful program that I can't tell you how much it matters to people. They tell us every day about the significance of it. Many of them saving their money for the end of the month. For many people, it is how they get through the end of the month with fruits and vegetables in their household. So it's an important strategy for a number of reasons. As Michael pointed out, it's a support strategy for our farmers. It allows them to bring home more money at the end of the day. It's an economic generator for the state of California. Obviously, we have ballooning costs around health care associated largely with diet-related diseases. Market Match is a strategy to head those challenges off. And for many people, quite simply, it is a way for them to ensure that they are able to eat and it's more money that they are able to spend on food. We know that for many low-income individuals, that what we sometimes refer to as the fresh food gap is significant. The choice that they are often faced with making is whether or not to get enough calories or to get healthy calories, and a program like Market Match allows them to not have to make that choice. They're able to get those healthy calories because the Market Match program helps support healthy eating. So thank you very much for your time today.
Thank you.
Good afternoon. Kula Koenig on behalf of the American Heart Association, American Stroke Association. Really support this, increasing access to fruits and vegetables. Thank you for your support.
Thank you.
Kimberly Chen on behalf of the California Pan-Ethnic Health Network and the Latino Coalition for Healthy California in support of this proposal for the reasons that my colleagues have stated and the reasons that Mr. Chair stated as well. Thank you.
Chair and members, Kathy Mossberg with both the California Food Policy Advocates as well as the Public Health Institute in strong support of this program.
Good morning. My name is Avinash Garam with the Natural Resources Defense Council. We strongly support and request your approval of the governor's budget request to fund CDFA's implementation of SB 27. SB 27 enacted first in the nation restrictions to reduce use of antibiotics in livestock production and to help preserve the effectiveness of life-saving medicines. The bill passed the legislature last year with broad bipartisan support, and now sufficient state resources are needed to implement the law's provisions. We have submitted a letter supporting the request in more detail, signed by 22 organizations, and we urge you to approve the budget change proposal. Thank you for your time.
Thank you.
Thank you, Chair and members. Andrew Shane from the California Association of Food Banks. We represent 43 food banks across the state, including the Los Angeles Regional Food Bank and Westside in your area, Mr. Chair. In addition to the comments that you made, I would just state that we know that beyond just pure diabetes, that there is a 27% spike in hospitalizations for low-income Californians in the fourth week of every month. And we know that that's obviously a burden on our medical health system, on our public health systems, and that's simply because folks are making choices between food and medicine and the other choices they should have to make. So thank you for your strong support of Market Match.
Thank you.
Hi, I'm Heidi McHugh. I work with Food for People, the food bank for Humboldt County. And in 2011, we worked with the North Coast Growers Association to put together a market match program at our local farmers markets. We've been, of course, funding it philanthropically since then. But in that time frame, with those efforts, we've managed to move from $5,000 annually in EBT sales at 5 farmers markets to over $60,000 last year. And that's because Market Match draws people, it connects them. The connection also reduces stigma, particularly for our elderly citizens. They're extremely excited about the opportunity to get that incentive. So we really need to keep that going because it's healthy for our community, both physically and economically. Thank you.
Thank you.
Good morning. Noelle Kramers with the California Farm Bureau Federation. I'm here on 2 items. First, on in support of the funding to implement SB 27. Antibiotic resistance is a very complex issue, and it will take significant effort to figure out how to do it right. California is leading the nation in this implementation, and we need to make sure that we figure out how to answer the questions that need to be answered and not just gather data for data's sake. We're also supporting a similar effort federally to support more funding for monitoring and implementation of antibiotic resistance, addressing that issue. We're also in support of the Market Match program. We want to see programs that support the purchase of California-grown, healthful food products, and Market Match is one way to do that. So, thank you.
Great. Thank you.
Mr. Chair, members, Mike Dillon, representing the California Veterinary Medical Association, CVMA, along with many, many others, were actively involved in SB 27, and we strongly support the funding for that program. Thank you.
Fantastic.
We also
Thank
support SB 27, Roots of Change. Yeah.
Got it. Thank you. All right. Well, I think that closes out this part of our hearing. Thank you very much for your presentations. And we have a number of items now to go back and vote on. All right, Mr. Gordon, go for it.
I feel like a motion machine. I'm going to move the following set of items. So the item relative to medical marijuana regulation, various departments, issue number 1. Under category 3960, Department of Toxic Substances Control, issue number 2. Under category 3930, Department of Pesticide Regulations, issues 1, 2, and 3. Under category 3980, OEHA, issue number 1. And category 8570, Department of Food and Agriculture, would move issues 1 and 2.
Second.
Thank you. We're going to vote. He's not going to repeat it. Yeah, we're going to vote now.
Bloom.
Aye.
Bigelow. Gordon.
Aye.
Patterson.
Aye.
Williams.
Aye.
Thank you. Did that cover everything? There were no votes. There weren't some votes that the Republicans were going to go up on. Excuse us for one moment. Great. That concludes our hearing. We are adjourned. Thank you very much.